You oversee 24 patients in a residential psychiatric facility from 10 p.m. to 6 a.m. Rule 1. Patient in room 7, listed in the log only, as D will not have a file accessible to you on the night shift system. This is intentional and has been cleared at the clinical level. D is on a specialized observation protocol. Every 2 hours, look through the observation window of room 7 and note in the physical log whether D is asleep, awake and still, or awake and moving. That is all. Do not make eye contact. If D is standing at the window looking back at you when you approach, mark the log and walk away. Do not speak through the door. The clinical team reviews your log entries each morning. They have never asked for more detail than what the protocol requires. Rule 2. At some point between 3 and 4 a.m., the lighting in the east wing corridor dims on its own, a known electrical quirk that facilities has been unable to permanently correct. During this dimming period, which lasts between 4 and 9 minutes, you will complete your rounds using your flashlight and stay moving. Do not stop walking during the dim period. Patients have reported independently, without coordination across 3 years of stays, that during the dim period they can see someone sitting in the corridor who is not staff. The descriptions across 17 separate patient accounts are consistent enough that the clinical team documented them. The figure sits near the water fountain. It has not made contact with anyone, but it watches the rooms, not the corridor, and we believe stopping in front of it draws attention. Rule 3. If a patient tells you they have been having a recurring dream about the Building S basement, document it in their file and notify the clinical supervisor in the morning. Do not ask them to describe the dream in detail. 6 patients over 4 years have described the same basement layout: a room, a hallway, a door with a specific kind of latch, and the center was built as a conversion of a private residence in 1979. The basement described by patients has never been fully mapped by staff. The description they give is consistent with a layout that predates the facility's current usage. We do not know how they know. We do not ask. Rule 4. There is a patient who has been at Crestwood for longer than any clinical record supports, longer than the facility has been open under its current licensure. His chart was transferred from a prior institution, but the prior institution does not appear in any state registry. He is calm, cooperative, and medically stable. Treat him normally. He will sometimes ask you what year it is. Tell him. He will nod and say thank you, and that will be the end of it. He asks every staff member he encounters. He has been asking since before you were born. The clinical team has decided this is not a symptom they are equipped to treat. Final rule. At shift end, the physical night log must be signed and placed in the intake tray. Before signing, count the patient check entries. There should be 1 entry per patient per round, 6 rounds per shift. If the count is correct,